Hello, today we are going to talk about bronchiolitis. I am tutor Wani, your only and the best tutor ever. So, what is bronchiolitis? It is an acute inflammatory obstructive airway disease of the bronchial, the small air infectious disease, common in infant and under 1 year. Okay, sorry, there's a mistake here. Under 5, there is 5 here. Under 5-year children. A viral lower respiratory tract infection, which is typically most severe in children and occur in annual epidemic and causes airway obstruction, cough, and wheezing. In children greater than 1 year, it is called viral induced wheezing. Causes. One of the causes, mycoplasma pneumonia. Okay, mycoplasma pneumonia. We have respiratory syncytial virus, which is RSV, adenovirus, influenza, parainfluenza, and coronavirus. Predisposing factor for bronchiolitis. One of them is prematurity, which means when a child is born premature. Then low birth weight baby, malnourished children. Pathophysiology, how the disease started, or the genesis of the disease. Virus in airborne droplets is inhaled by the infant. In the bronchial, virus causes inflammation and production of mucus exudates. This causes narrowing of the airway, which causes wheezing and difficulties in breathing. And the inflammation and the mucus trigger cough. What are the symptoms? Cough is one of them. Difficult breathing, sometimes we call dyspnea. We have wheezing, nasal congestion, someone having just blockage of the nose. We have poor feeding, often fever, respiratory distress, someone facing difficulties in breathing, or low or diminishing of breathing. Hyperinflation of the chest, a lot of gas or air in the chest, fine crack, and then wheezing. Clinical features. Course of illness usually lasts for 7 to 10 days, and that is a congestion period, and breathing gets worse for 3 days, stay the same for 2 days, and then improves. Cough will remain for up to 1 month after acute illness. Differential diagnosis. Other conditions that present with the same will be foreign body aspiration, when you take in foreign bodies in your lungs, pneumonia, asthma, pertussis, which sometimes we call whooping cough, heart failure, and then anaphylaxis, which you can say reaction or allergic reaction to one of the substance, either drug. What investigation do we do? Usually clinically, but the following tests can be done: chest X-ray, full hemogram reveals lymphocytosis. Okay, lymphocytosis. Management. There is no treatment for causes of virus. Treatment is supportive only. Many infants do not need admission to hospital if they are feeding and breathing well. Breathing support. Infant with respiratory distress and low oxygen should be given a nasal cannula oxygen, nebulized 3% saline. We call it hypertonic saline, and it's the only treatment with proven benefit, but is often unavailable. You can try nebulized salbutamol 2.5 milligram to assess for response, but this is not of benefit for most babies. Feeding support. Infant with respiratory distress often struggle to breastfeed, therefore the mother can express breast milk, and this can be given via NG tube if respiratory distress is very bad. Some cannot tolerate NG feeding. IV maintenance fluids should be given. Additional measures. Paracetamol should be given for fever if there is any concern about pneumonia. Antibiotics like Expen and gentamicin should also be given. Due to a space easy spread between patients, isolation of affected patient is very important. Complication. Secondary bacterial pneumonia. Prevention control. That is one of the complications, the secondary bacterial pneumonia. And then prevention control. There is no prevention mechanism in sub-Saharan Africa. Many management is isolation of infected ward cases to prevent a spread. Management at the PSCC, mild with wheezing and respiratory rate of 50 to 60, no cyanosis, ppf 50,000 international units OD for 5 days. Feeding and hydration. And then severe with wheezing, fast breathing of 60, refer to the hospital. At the hospital, admit in the pediatric ward, put IV line for drugs and feeding fluids. Bedside penicillin, that is Expen, 50 mg per kg, 50,000 international units. That is 50,000 international units per kg every 6 hours for 5 days. So, chloramphenicol 25 mg per kg 6 hours for 5 days plus nebulized salbutamol 2.5 mg in 4 meals of normal saline every 6 hours. Nebulized adrenaline 1:1000, 1 meal in 2 to 4 meals of normal saline every 2 to 4 hours until wheezing free. Encourage feeding and oral fluids. Prevention. Avoid exposure to cold weather or viral infection. Proper hand hygiene with patients. Thank you so much. God bless you and see you next time. Thanks. Bye.